Welcome, everyone. I'm Dick Deming. I'm Medical Director of MercyOne Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. We've had a bit of a change of plans. My guest that I was going to have with me, a thoracic surgeon, got called in for an emergency, so he will not be our guest, and our topic will not be thoracic surgery. Instead, the topic is going to be integrative oncology and survivorship care. And my guest is myself. So we're going to talk about something that you may not know about. We call it integrative oncology. Another way of referring to it is integrative medicine in the oncology setting. So let me set it up a little bit by talking about survivorship care, and then we'll bring into the conversation what integrative oncology is. So survivorship care is an often overlooked part of cancer care. A good cancer center takes care of killing cancer cells, but a great cancer center takes care of patients and their families everywhere throughout the continuum. As I said, many cancer centers, appropriately focus on the ongoing treatment of cancer, but there are millions of individuals, in fact, about 18 million in the United States, that we call cancer survivors that also need ongoing care. After someone finishes their cancer treatment, they may have lingering physical, psychosocial, emotional, financial, spiritual, philosophical issues as a result of their cancer diagnosis or their cancer care. And studies have shown that we don't, in the United States, do a very good job systematically of taking care of those patients who have completed their cancer treatment. So we call this survivorship care, and the survivorship care includes many different facets. Number one, it's obviously doing ongoing surveillance for the cancer that the individual was treated for, making sure that that cancer has not come back. But second, it's also doing surveillance for other cancers that the patient may be at higher risk for. Third, it's educating and individuals, patients, on what they can do to reduce the risk of developing a future cancer. So some of that is health and well-being, eating healthy, not smoking, engaging in physical activity, stress reduction, managing weight, alcohol consumption, sunscreen protection, getting vaccinations for those types of cancers that we can prevent by vaccines, and mitigating your home for radon. Those are just some of the examples of the education that could happen in a survivorship clinic. Next is paying particular attention to the late effects of cancer. So, for example, women who have undergone surgery and radiation and chemotherapy for breast cancer. Millions of women are surviving breast cancer, but they have lingering effects. Some of the effects that breast cancer survivors may face would be lymphedema, swelling of the arm, also decreased metabolism. So many of the breast cancer patients are thrown into early menopause with chemotherapy, and menopausal symptoms can also be enhanced by some of the anti-estrogen medications. So there can be hot flashes, vaginal dryness, sexual dysfunction, weight gain, and generalized fatigue. With the chemotherapy, there can be issues related to peripheral neuropathy, numbness and tingling of the hands and feet. There are also some of the chemotherapy drugs can cause cardiac dysfunction. So in some individuals, surveillance and survivorship also might mean doing echocardiograms or paying particular attention to heart function. So, for other types of cancers, for example, head and neck cancer, individuals who've been diagnosed with cancer of the throat go through an aggressive chemotherapy and radiation therapy treatment, sometimes with surgery as well. Those patients have a high likelihood of being cured of their cancer, but a super high likelihood of developing ongoing lifelong side effects. Some of those side effects that head and neck cancer patients face include changes in the saliva production. We call that a dry mouth or xerostomia, swallowing difficulty, dental issues, stiffness of the neck, numbness of the hands and feet, and other side effects that can be related to the chemotherapy. Those side effects can be very debilitating, and unless you're asking the patients about them and paying particular attention to them, you may not find them. Another side effect for those individuals going through head and neck cancer treatment can be low thyroid or hypothyroid that the patient may not know, and if we don't do testing for it, we may not find out. Another particular group of patients that experience significant long-lasting side effects are individuals who have pelvic malignancies, and that could be prostate cancer in men, rectal cancer in men or women, or gynecologic cancer in women. In those situations, pelvic surgery, pelvic radiation, and chemotherapy can cause lifelong side effects, including sexual dysfunction, loss of control of bowel and bladder, and some weakness of the pelvic floor. And again, unless we're asking patients about those side effects, we may not be aware of them. Other lingering issues that cancer survivors face include some psychosocial distress related to fear that the cancer may come back. A common example of that is scanxiety. When individuals have their annual scan at some point, even the idea of going in for a scan can trigger some distress. Financial issues related to cancer treatment. Even people with very good insurance may have to pay $10,000 out of pocket per year. For some individuals, they just take that in stride and use their savings. But for some individuals, that can turn them completely upside down and perhaps even force them into bankruptcy. Other psychosocial issues that patients experience, especially young patients who are maybe just starting their career, is their cancer treatment and the side effects of cancer may affect their ability to maintain their same job. They may have to take time off for disability. That might affect their promotions and their advancement in their company. Also, personal relationships can be affected, especially for individuals who maybe have not found that significant other yet, and all of a sudden they're kind of pulled out of the dating field by this cancer diagnosis and the changes that happen with the cancer diagnosis, and establishing new relationships. New relationships may be difficult, or individuals going through cancer treatment may face stresses in their own personal relationship. Even their marriage may suffer due to the stresses. Other issues that young cancer patients face are fertility issues. Many of the chemotherapy and some of the radiation regimens may actually affect fertility of men or women. Many times when a patient is diagnosed with cancer at a young age, they haven't started having children yet, there's a real urgency on the part of the patient and the doctor to get treatment started early. And some of the things that could be done before treatment gets started, like preserving sperm or eggs, can take time and effort, and sometimes those are overlooked before chemotherapy gets started. So fertility represents another special issue. Spiritual issues also arise as individuals who might have a great spiritual faith, but their faith can be rocked a little bit if they thought that God was, all caring, all compassionate, and could do anything. And how do we live in a world where bad things can happen to good people? So I listed several of the issues that cancer survivors face, and unless a cancer survivor is going to a clinic that specifically deals with those issues, they may not get the attention they need. We're going to talk about what we do at the MercyOne Cancer Center to address all of these concerns: the physical, psychosocial, emotional, financial, spiritual, philosophical, all the issues that cancer patients may experience as they're going through their cancer treatment and as they're going through survivorship. So that brings me to talk about integrative oncology. There's a field of medicine that we call integrative medicine, which is bringing in healing modalities that don't necessarily kill cancer cells, but can be very healing, and bringing it into the cancer center. And some of those therapies are healing therapies that are related to touching the patient, like massage, for example, and some are more counseling services. So at our cancer center, we provide integrative oncology services to patients, whether they're just getting started with their cancer treatment, they're in the midst of their cancer treatment, or they are done with their cancer treatment and are survivors. And the programs that we have as part of our integrative oncology include the touch therapies, such as massage therapy, chiropractic care, acupuncture, Reiki, reflexology, physical therapy, osteopathic manipulation, and speech therapy. But we also have a number of counseling services that also fall into this category of integrative oncology. And the counseling services include mental health counseling for the patient, mental health counseling for the family member, genetic counseling, financial aid counseling, social work, palliative care, spiritual counseling, sexual health counseling, music therapy, art therapy, pet therapy, nutritional counseling. We also have a pharmacologist who meets with individuals to talk about supplements and vitamins. And then we have a living with cancer support group, also spiritual counseling. So those are 22 different programs that we do as part of our integrative oncology that are available to patients, whether they're just getting started or are done with treatment. To access these services, patients can refer themselves to the MercyOne Richard Deming Cancer Center for the integrative oncology, or they can be referred by their other physicians. What we do is, first we have an hour-long meeting where I review with the patient all of their medical history, all of their cancer history. We go through the entire cancer journey from diagnosis to where they are now. If there are individuals that are done with treatment and are cancer-free, we'll actually provide them with a treatment summary so that they can have for their own record all of the important dates, the diagnosis, the pathology, the stage of disease, which cancer treatments they received in terms of which drugs they received, which radiation treatments they received to which parts of the body, what doses, so a complete treatment summary. And then we go through all of the categories that I just mentioned. So we'll talk for an hour about what are the lingering physical, psychosocial, emotional, financial, spiritual, philosophical issues that you as a patient are facing. And then we'll match each of those issues to the different services that we have that we can provide to provide comfort and relief for those services. As I mentioned, these services are available to individuals, whether they are just getting started with treatment, in the middle of treatment, or are survivors of cancer and are cancer-free. Those two different categories of clinics we refer to as survivorship clinic for those patients who are done with treatment and are cancer-free. And for those who have ongoing cancer and are kind of in the category of treatable but not curable cancer, that's called a living with cancer clinic. In addition to all of the services that we provide with the clinics and the integrative oncology, we also have, as many of you know, the survivorship program that we do out in the community, and that's called Above and Beyond Cancer. Above and Beyond Cancer is a separate and distinct public charity. It is not part of the Mercy Cancer Center, and it is available for patients and survivors and family members wherever they live in central Iowa. So these programs are centered around physical activities that cancer survivors do together, being facilitated by oncology-trained fitness experts. And they include not only the physical activity, but the camaraderie and the social support that happens when you're doing activities with other people. In the Above and Beyond Cancer program, we have about 25 different activities every week. And those activities include yoga, meditation, Tai Chi, Qigong, water aerobics, land aerobics, walking, hiking, outdoor cycling, indoor cycling, rowing, paddle boarding, forest bathing, cooking classes, ballroom dancing, water aerobics, land aerobics, cross training, weightlifting, and I probably have left out about 5. In addition to all of those programs, which are free and covered by philanthropy, once a year, Above and Beyond Cancer takes a group of cancer patients, survivors, family members, and professional caregivers on a mind, body, spirit journey somewhere in the world. Above and Beyond Cancer, his birth date was in April 2011, when we took 29 cancer survivors and caregivers to Mount Everest Base Camp. Over the last 14 years, those annual trips have included journeys to the summit of Imjase in the Himalayas, the summit of Kilimanjaro 3 different times, 2012, 2017, and 2023. They've included cross-country bicycle races from California to Annapolis, Maryland, a 3,000-mile bicycle ride, actually a race, which we completed in 6 days, 21 hours, and 17 minutes, and a run across America, 4 marathons a day for 40 days in a row, from the Pacific Ocean just outside Tacoma, Washington, to Rehoboth Beach, Delaware. We've also done domestic trips to the Colorado Rockies, the canyons of Utah, and the Grand Tetons of Wyoming. Last year, our trip was the northern part of the Appalachian Trail through New Hampshire and Maine. In addition to those, we've also done a trip to South America where we went up and over the Andes Mountains to Machu Picchu. And this year, we are going to go to southern Chile, where we will be trekking and climbing at Torre del Paine National Park in Patagonia. One other trip I left out was in 2018. We went all the way to Tibet and circumambulated the most sacred mountain in all the world, Mount Kailash. Those trips, again, we do just once a year, and we engage survivors and caregivers on these mind, body, spirit journeys. A couple of other activities that Above and Beyond Cancer does is to provide hotel rooms for cancer patients that are undergoing cancer care more than 50 miles away from where they live. So if you are getting your cancer care more than 50 miles from your home, we can provide a hotel room for you in the city or town in which you're getting your cancer care, anywhere in Iowa. So we are serving cancer patients getting cancer care in Dubuque, in Davenport, in Iowa City, Waterloo, Fort Dodge, Sioux City, Des Moines, any place in Iowa where cancer patients are getting their cancer care more than 50 miles from home. Another novel aspect of Above and Beyond Cancer is we do some very fun fundraising events that are also kind of part of mission delivery. Many are physically active and are around physical activity. We like to do cycling, as I mentioned, once a week in the summer. We have a group cycling ride. On June 21st this year, we're doing our second annual Ride in the Park. And that is where we have a 5-mile loop through Waterworks Park. And we do a 6-hour bicycle ride as we do loops through the park. And not only are you riding loops, we also have fun musical groups that are playing and lots of fun food and fun activity for the kids. Another one of our fundraising activities is our jump event. And there's still room if you would like to be part of our jump event. So if you would like to jump for us, we take you up in an airplane and we open the door and you jump out. But we do attach you to a professional parachute jumper. So it's a tandem jump. To do the jump, you agree to raise some money for Above and Beyond Cancer. We film you. It's a lot of fun. There is some fear involved, and that's what makes it fun. You get about a 1-minute free fall, and you get then about a 5-minute float with the parachute open. It doesn't require any skill or talent. A sack of potatoes could do it, probably better than most of us because presumably a sack of potatoes doesn't have any fear. But that's going to be August 2nd this year. And if you would like to be a celebrity jumper for Above and Beyond Cancer and agree to raise some money, you too can jump out of a perfectly good airplane. So what we've covered tonight is integrative oncology and survivorship care, and the important aspect of being seen not just during your cancer treatment, but also being seen by individuals who know how to pay particular attention to the surveillance for the cancer you were treated for, surveillance for other cancers that you might be at risk for, and paying particular attention to the lingering and late side effects that individuals may face as a consequence of their cancer treatment. We've talked about integrative oncology and the 20 plus different services that we provide to patients at our integrative oncology clinic through our survivorship clinic and our Living with Cancer clinic. And we talked about all of the activities that we do with Above and Beyond Cancer to help enhance health and wellness. The old-fashioned way of dealing with patients going through cancer treatment is to tell them, take it easy, take naps, eat bonbons, treat yourself. That doesn't work very well. We now know that 85% of women going through breast cancer treatment will gain 20 pounds just going through treatment. It's not fair, but it can be avoided. And how do you avoid that? Is you engage in vigorous physical activity, you eat healthy, you have all of the support, and you can actually reduce the risk of side effects and improve the outcome of cancer treatment by engaging in those healthy activities with Above and Beyond Cancer. So it's a short program tonight. I hope you enjoyed learning about our integrative oncology, patient support services, and also Above and Beyond Cancer. And with that, I'll open it up to questions. We have a live studio audience here with me, many of whom are going to go upstairs with me after our conversation and engage in spin class, which I teach once a week here at the MercyOne Health and Fitness Center. Angelina.
Yes, I just wanted to add in that pole walking is another good added, especially for me, because I have the lipedema. It really helped me with balance and motion and circular of your arms.
Excellent. And for those who don't know, tell us what pole walking is and how pole walking might be different than pole dancing.
Oh yeah, totally different there.
Totally different. Okay.
They're like these poles that you probably would see like a
Like a hiking
ski
pole.
hiking poles. Yeah.
Hiking pole.
They have
Yeah.
these little cute little boots on there. And you're first trained to show how to walk. You don't think about how you're supposed to walk. With your leg and your arm are walking opposite of each other.
Right. So as you lift your right arm, you're moving your left leg forward.
Yes.
Yes. So
and it creates that balance too. So you're
walking
getting,
with hiking poles, so you engage your upper body as well.
yes, and you're getting a full workout that way. I mean, you don't have to walk very long or far. You can even do it in the fitness center and the track area if
Right.
the weather doesn't.
So thank you for adding that. So yeah, walking. We have a couple of different pole walking groups each week, and we also have a hiking group. And actually, you can hike with poles, but we call it hiking when we take off in the morning and go on some hiking trails. So that's once a week, and we do the pole walking and the hiking throughout the year. 52 weeks a year. Some of our outdoor activities with Above and Beyond are only in the summer. So for example, the bicycle group only meets in the summer. Paddle boarding, forest bathing, those are summer activities. We are doing indoor rowing throughout the year, and this year we'll actually have a boat. So we'll be doing outdoor rowing this summer. Other questions or comments in the group?
A question about the integrative therapies. You've been out in front with these and been doing them for some time now. Any surprises along the way as to how well some of them have been received and work maybe better than others?
Yeah, that's a great question. We have actually done a study when we started our integrative oncology program where we did quality of life assessments of our patients before and after they engaged in the integrative oncology program. And very close to 100% of the patients experienced improvement in quality of life. We're still analyzing the data, and there will be a peer-reviewed paper that comes out of it. There are some of the activities are based on Eastern principles of physiology and anatomy, if you will. So, for example, acupuncture and Reiki both come out of Eastern healing arts that are based on an understanding of energy that flows through the bodies through various meridians. Having been trained in Western medicine, I don't know exactly how all of the various placement of needles and work with energy work, but I can tell you that every patient who experiences them, and part of it is because of the kind, caring, compassionate nature of our providers, experience a feeling of well-being. Acupuncture in particular can help with peripheral neuropathy of the hands and feet, but it also can be very helpful for stiffness of the neck, insomnia, and other conditions. And so as a Western doc, I might not know exactly how a needle in this particular part of the body affects the physiology, but it's thousands of years of experience, and it is helpful for many different situations. None of the activities that I mentioned in integrative oncology I promote as something that will kill cancer cells. These are activities and therapies that will promote healing and wellness and are particularly helpful for addressing certain side effects of treatment. But we're not saying that these are therapies that we bring on board to help kill cancer cells. We call it integrative oncology because it's not instead of conventional treatment. It's integrated into the care along with traditional surgery, chemotherapy, radiation therapy. Other names have included alternative or complementary. I'm not particularly fond of the term alternative medicine because this is an alternative to regular cancer treatment. It is complementary, and And another reason to call it integrated is it's done in the cancer center, and that all of our practitioners that are doing the various treatments in integrative oncology are aware of exactly what type of cancer, the stage of cancer, the location of the cancer, and the other treatments. So it's very different than if you just went to a chiropractor elsewhere, or an acupuncturist or a massage therapist in a strip mall. I mean, they may be doing very good work, but they're not going to have the understanding of what your cancer is, where it's located, what your treatment, what your surgeries have, unless you tell them that. Here in the cancer center, all of our certified therapists are knowledgeable of your cancer history. So another reason that we call it integrative oncology. Yes, Poon.
Yes, Dr. Deming, at the MercyOne Richard Deming Cancer Center, how many patients would you say get treatments on an annual basis?
Yeah, so, we see about 500 new patients a year that have never been seen before, but we see many patients on an ongoing basis. So I have been a cancer doctor in Des Moines for almost 36 years. So in terms of cancer survivors, patients that I see once a year for a survivorship visit, they may also be coming to get the integrative oncology services. And anybody who comes into our center who we enroll in the integrative oncology program may have 9 visits or more. They might be seeing a massage therapist 3 different times, a chiropractor 3 different times, acupuncture. So when you look at the number of patients that are being seen for treatments and not unique patients, we provide thousands of services per year to hundreds of different patients.
What would you say to someone that's been diagnosed with cancer and looks at the Above and Beyond cancer programs and says, I don't have the money for that, I don't have the time for that, and I'm very shy, and so I don't think Above and Beyond cancer is for me? What would you say?
Yeah. Great question. I would say, first of all, in terms of money, the Above and Beyond programming is for the most part free, and included in the Above and Beyond programming is 3 months free membership to either the YMCA or the Mercy Health and Fitness Center. And I would say, in terms of being shy, you will have friends within 5 minutes. It's a very welcoming group that will welcome you with open arms, and you don't have to worry that you're not able to participate. There's lots of different levels. So typically what we'll do with someone, you can just go online and see where a class is and just show up. So for example, at 6:45 tonight, I'm teaching spin class. If you want to just show up, you'll be part of the class. But we also provide the service to meet with you ahead of time, have one of our certified oncology personal trainers meet with you, talk about where you are right now in terms of fitness and stamina, what your desire is, what your goals are, and then create a curriculum from the 25 different classes that we offer, which ones might be best for you where you are right now. And then you'll feel very welcomed once you get into the class. So not only provides the physical activity, which can help with managing weight, with improving stamina and strength, but it's also been shown that physical activity can reduce the risk of developing another cancer. Another question, Poon.
Yes. For some, you mentioned that the center is being funded by philanthropy. Someone watching tonight that may want to contribute, how can they do so?
Yeah, there's so much good that's being done in Des Moines, and much of it is being done by philanthropy. So thanks you for bringing that up. I mentioned, I think, 22 different services that we do throughout the integrative oncology program. About 18 of those are provided totally free of charge. Now, they're not free in the sense that that they don't cost anything. They cost us about $250,000, $300,000 a year to provide that programming, and we do it through the generosity of grants and philanthropy. So anyone who would like to contribute to those programs that we provide to patients for free can do so by making a contribution to the MercyOne Foundation for the MercyOne Richard Deming Cancer Center. Those individuals who would like to contribute to Above and Beyond Cancer, which is a separate 501c3, and also provides hundreds of thousands of dollars of programming per year, can make a donation to Above and Beyond Cancer at aboveandbeyondcancer.org. Both of those are 501c3s and are tax deductible. And we couldn't do the work that we do at Mercy Cancer Center or at Above and Beyond Cancer without the generosity of contributors.
Not to be overstated, there's a value of the cancer education series, the video series that we do. When someone's diagnosed with cancer, as you well know, a lot of times they don't know anything about the cancer that they have. They've got tons of questions. The questions come up all the time. And, physicians, as much as they're caring, they can't answer all the questions all the time. But you can pose your questions and get them answered on this show every week. I think that's really cool.
Yeah, we've been doing this for 15 years, and we have topics that are far-ranging, everything from thoracic surgery to breast surgery to advocacy and lobbying your legislators about bills that are involving healthcare, to yoga, meditation, Tai Chi. Almost all of the services we provide, we've given a particular topic, a talk about those services. So we provide information about different types of cancers, different types of cancer treatments, as well as wellness and health activities. So it's a great place for a source of information. For any individual looking to either watch a program again or looking at our library of programs, again, we have 15 years of doing this, and you can see reruns of our past programs at the Above and Beyond Cancer YouTube channel or the Mercy Cancer Center website. Other questions from our live studio audience, or any questions? If you're watching us live streaming, you can put your question in the comments section. Well, hearing none, again, we want to thank you. This was a little bit of impromptu because our guest, Dr. Alameri, thoracic surgeon, who was going to be my guest, got called away for a medical emergency. So we'll have him back on another day. But it's been nice chatting with you. If you know someone who would benefit by listening to this program again and learning about all the programs available at the MercyOne Cancer Center or through Above and Beyond Cancer, you can watch this program beginning tomorrow on demand at the Above and Beyond Cancer YouTube channel or the Mercy Cancer website. Thanks for joining us. Thanks, everyone.